It. It is 3:03. We have a quorum, so, I'm going to start by taking the roll. Abby? Not here. Rocky? Not here. Robert?
Here.
Aaron?
Here.
Arlene is not here. Lisa? Is here.
Hello.
Linda is here and Mary. Okay. I made a note at the last meeting that I
Yes.
would say this is the time for public comment, if there are any public comments, so. We'll give it half a minute here to see if there is any member of the public
No.
online, okay.
Well, establish it.
Establish quorum.
We need to vote on the agenda.
Yep, did we approve the agenda?
No,
No,
It's
not
after
now.
public comment, yeah.
Yeah,
You
I'm
need to
really
be
worried
active.
about this.
No, it's establish quorum, public comments, you're correct.
Okay, so the next thing is approval of the agenda, which was sent to everybody in advance. Can somebody please move to approve the
I'll
agenda?
make that motion.
Thank you. Second? Robert? I'm gonna ask everybody if you approve of the agenda. Robert,
Yes.
Aaron,
Yes.
Lisa? Lisa?
Lisa,
We're having trouble hearing you, Lisa.
Okay, thank you very
we can't hear.
much. Bye.
Lisa?
Laura, can you mute briefly?
I love it. I mean, I love it.
Can I do what? Can I mute? Yeah.
Can't hear anybody.
Okay, Lisa, are you there?
She just muted herself.
Just, she unmuted again.
Lisa, we cannot hear you, so we can't take a vote from you.
Yeah, unfortunately. If you can check your audio,
Oh, she's muted again. Oh,
she
You
can
gotta go to
definitely,
your computer audio, which you missed when you signed in, so you might want to have to sign out, sign back in and hit your
You don't-
computer audio.
you don't need to, you,
That's
just
what I have to do.
the up caret here. You can see that and select whichever audio incoming. Oh, no, you wanna know why? Hold on.
Computer audio?
Alright, try again, Lisa. Just say hello.
I don't even know if she can hear us, if she's not got her computer audio on.
She can hear us because she's muting and unmuting in response to questions.
Mhm.
We're not hearing you.
And unfortunately, unless you can indicate yay or nay, we can't
We can't
move
Take a
forward,
vote.
which is ironic. Lisa, can you turn your camera on briefly?
Maybe she's on a phone call.
Who-
Possible.
How many people do we have total?
We have, which five,
Five.
four,
We
five
have
is,
8 and 1 open seat.
yeah,
But do we have 8 or 7? Nobody has
we have
8.
9,
Oh, that's why. the problem.
yeah,
We have 9 seats, 8 of them are filled.
yeah.
25, 1, 2, 3, 4, 5.
Can we put Lisa on speakerphone?
We can. Mary Ann, I assume you're okay with the agenda.
Well, we need to get it approved or this would be in.
Do you have her cell phone?
Do you have Lisa?
Because
Lisa?
technically, if we can't communicate her, she doesn't count for quorum, so
She doesn't.
Yeah.
But do you have, do you have her cell phone?
I do not.
Do you have her email? Email it.
Yeah, I think I do. Well, I don't know what that's gonna
And
do.
then she can call my phone. We've used my phone before in these meetings. Yes, we have.
It's not,
So long as she's on a speakerphone, you can use it. I have a speakerphone at the Concom sometimes, if it's not functioning. I've been through billions of meetings with this little number here.
there's no way to determine the identity of the person on there unless there's a second way to do it, which is the issue. But,
Can you
Oh,
turn the
she's-
camera
she's-
on?
Why
no,
not?
I cannot, you can't remove, thankfully, you can remotely turn cameras on.
That was my guy, but that's why.
But it looks like she signed out, she'll sign in again, let's just give this a second. Technology.
Yeah, technology.
Well, just so you know.
And
we've
we're
used
supposed to rely
billions
on
of times
AR
and people
when this
cannot get it.
old stuff
It-
doesn't even.
In 5 years.
There's a lot at the hospital.
It's a little, I mean,
They use it a lot in many places.
Nobody's gonna say anything.
that's not the indicator of legal.
I got that, but they have used this and we've had forums with this.
If we can get that to work Just gotta make sure, so it looks like she's leaving and she's coming back in. There we go. Let's try.
Okay.
If she didn't hit her computer audio, it's not gonna work.
Okay, there's Lisa.
You need to unmute.
Oh, now we can see Lisa.
Can you hear me now?
Sorry about that. I don't know exactly what's going on.
I'm on a different computer. I just switched out. Sorry.
Just say yes for the agenda.
Yes.
Okay,
Okay, we have approval of the agenda.
so now we have a quorum at 3:08.
The next item on the agenda is the meeting minutes of the last umpteen minute
I
meeting.
found them,
Um,
but I'm cleaning up from my office.
well, I was going to suggest that as I have time, I will listen to these and I will get all the minutes up to date and get them submitted to the town,
You
so
got the time.
we're up to speed. When I have the time, I'll get around to it. And when we elect our new officers.
But except that I do have one set that I pulled out, so I'll
Okay, so
email
you're
you
gonna
what
do
set
March
that is.
5th.
I don't know if it's March 5th or April that I pulled up.
Well,
I'll
please tell me
email
so
you.
that I don't waste my time.
I'll email you which one it
Okay.
is.
Um,
And once we get a
Okay,
full
so,
board, we
I
have.
mean, we will have at least one new member coming up, and when we get our open seat filled, that's the time for us to elect new officers, and at that time, we need to have a secretary assigned, so just keep that in mind. Somebody will have to, if we don't have one, we're going to appoint one.
Where are we going? Where are we going?
Who is on the phone at the same time?
It's background for Lisa, I believe. Hold on, I'm just gonna mute you, Lisa.
Okay. Next.
Now on to the official business of the meeting. The first thing I want to talk about is a recap of the Senior Man and Senior Woman of the Year while it's still fresh in our minds. For us to talk about what went well and what didn't go well so far. And to remind people that the celebration of Kathy Breeder and Lee Saperstein is going to be this coming Monday, July 7th at Sherburne Commons at 4:30 p.m. If you have not yet let Laura know by email that you're coming, please let her do so. It looks like we're gonna have about 75 people. And we will have, first a ceremony. Dick Herman will be our master of ceremonies. And then we will have, a smorgasbord of appetizers and wine, beer, sodas, water, that sort of thing. So please come. It should be a fun event, actually. We're gonna have a lot of people.
That's great.
So, I'm looking for comments about how Senior of the Year went this year and people's what your opinion is, what could be improved and what we should keep.
I don't know, I thought it ran
I thought it
very
went
smoothly.
smoothly.
Yeah.
Except that if people were a little out of rotation, so we didn't get as many
Mhm.
recommendations as we usually do, but
We had the process open for as long as we
I
normally.
know, but it's
No,
sort of out
We
of.
usually have it twice as long.
Okay.
Usually for
Yeah, it
two
was just
months.
weird because we didn't do it until
It
June.
was like we were usually starting in February,
Yeah.
right? Yeah, okay.
I mean, the final product, it went right along.
Yeah,
And you got Laura, we got the gift certificate sorted.
Yes, I have the
Okay.
gift certificates here.
Perfect.
Yep, thank you very much.
You got,
So
you got stuff from the state?
Libby is supposed to be there to give, she'll represent the town. No one has stepped forward to represent the state, so we're gonna ask Libby to represent the state as well, but
Did
she'll
they
be
send
there
it
in
down?
person.
Whatever the proclamation is from the state?
The award thing.
Laura, do you have anything from the state or?
Not yet.
We normally do, right?
Well, they're
I know we
sending
still
them.
are.
They're
Huh?
sending the citations to the salt marsh.
Well, it's 4 days from now.
Yeah,
So
well,
you have the citations, you just don't have a representative to hand them.
no, I
to.
don't have the citations yet.
Oh,
Yeah,
oh,
They're on their way. They have not arrived
I
yet.
hope they didn't
Correct?
mail
oh, we'll see.
them.
But Libby is going to have to stand in for the state and she will be great at doing that. I don't think that'll be a problem. And then usually NCEA gives a gift certificate, but this year it's going to be the town that gives a gift certificate to each winner for the Sea Grill. So I'll do that representing the Council on Aging. I'm gonna do 2 minutes about the Council on Aging and our process and who's on the council. So we're not faceless people. And then I'll give them each a gift certificate.
Why isn't NCEA doing it?
Because they
I
said,
didn't know the town could, so,
Gift fund from the Salt Marsh.
okay,
It went through finance,
okay, so it's the Salt Marsh doing it.
the town,
But
For the
who-
Salt
who's
Marsh.
in the Salt Marsh.
no, just the town.
So Salt Marsh isn't involved.
The Salt Marsh Gift Fund is town.
so,
You're missing my point.
for those of you who are online, do you have any comments about the process or does anybody have questions about Monday's event?
Were they excited? How, what was their opinion when you called them?
Oh, they were both absolutely delighted, yeah. And,
Sure.
and I know both of them personally, so, you know, they were really happy about it. I think they're looking forward to Monday. Kathy is bringing 10 or 11 people, her
Well, she's got a
Family-
billion of them out there.
Her family is here from California and.
Oh, really?
Yeah,
Nice.
so they're gonna be there as well. And I know Lee's granddaughter is here from England.
Yeah.
She's working at Millie's all summer, so I hope she'll be there. Depends on her work schedule. So I think they're both very delighted and honored, to tell you the truth. So it should be a good event, very upbeat. Well, if nobody has any more comments about the senior of the year, I'm gonna move on to preliminary discussion of the senior expo. At last month's meeting, everyone seemed to agree that October 18, which is a Saturday, is probably the best one for us to focus on. So after this meeting, I will contact the school who actually invited us to come back again this year, so
Wow.
I don't think that's gonna be a problem. But who knows? And I had already checked the Chamber of Commerce calendar, so I know that there's nothing so far that would compete with us on October 18, but who knows what will happen there. And then I think I'll try to put together a committee to plan this like we did last year, which seemed to work really well. But so be thinking about participating in the committee. It really helps when a lot of people do, everybody does a little bit, works a lot better. And if you haven't done anything else hands-on, this would be a good opportunity, so I'll encourage that. Anybody have any questions or comments about Senior Expo this fall? Okay. I'll move on to Jericho Mealy and his report on human services.
Not a massive amount to report this month. I'm trying to think of what has happened. We are initiating a community needs assessment, which is going to be a combination of focus groups and primary data collection and then some surveys going out. We're getting the last contract, we're figuring out who's going to be doing, which contractor is going to be doing this. But we're hoping to be doing some kickoff meetings and initial stakeholder meetings, probably towards the end of summer, early fall, which means that it'll be people reaching out to Council on Aging, Nantucket County Center for Elder Affairs, and probably Elder Services. Yeah, specifically in the elderly thing, although I don't think you'll probably help with some of the focus group meetings for CRC and CHS.
Yeah.
But it's not the grant review like the last one was. And then the reason we're doing this is so that we can collect a bunch of data to determine what services exist, what services don't exist, compare those to other municipalities and counties to find gaps, and then use that to argue for additional funding, both from the town and from external grant sources. The other big project we're doing, there's a couple of different, more on the health side, but there is a long-term tick-borne illness study that will be doing some collections They want to monitor people who have had tick-borne illnesses over the period of a couple of years. And they're doing primary recruiting among Nantucket natives and long-term residents who have had a tick-borne illness at some point in their life.
Twice.
At least twice for me, one that I can think of. Past that, I have been named the Deputy Director for Health and Human Services, so.
Oh,
Thank you
congratulations.
very much. And I'm gonna be doing a little more health and internal administrative tasks. I'm hoping that you don't see any disruption in how things go with this area, Council of Aging, Council of Human Services, or the Contract Review Committee. And then I'm gonna be trying to get some additional certifications and so on for Lexi Alexandra, who's was in Ann Medina's role, or is in formerly Ann Medina's role of the Office Manager for Human Services, to help expand what's going on in human services specifically. And I've spoken with Laura about a couple of things along this line as well. Past that, I'm trying to think what else we have going. Not a whole lot in terms of direct human services or health that's super related to the contract or to the Council on Aging.
Oh, yeah, I've established a relationship with Betsy Connell, who's the executive director of the COAs for the state of Massachusetts, if that would be of any help. I could network you to Betsy.
I mean, it certainly would not hurt. I'm always looking for more ideas on what we can be doing. I actually recently went to at the Outer Cape Community Solutions Conference. We're finding, when we look at the data, one of the closest regions to Nantucket in terms of a lot of the challenges we face and potential solutions for them is the Outer Cape. Basically everything from Eastham out to Provincetown. And there were a lot of really interesting programs that they were running through the councils of aging out there. And I
See,
think
Betsy has 350 of those council of agings.
well, I'm doing some work with some people in New Hampshire who are looking for other services, and it has really shown me how much better things are here in Massachusetts in terms of services than certainly New Hampshire, Vermont. It's wild.
Well, Betsy's very approachable.
Yeah, I'll definitely reach out and have a chat with her. If you can think of a good segue for the introduction, I'd be happy to chat.
Sure.
Question for you on stay on that subject,
Mhm.
because it might have been before you came to us, but we had talked about the fact that we don't have any power to do anything because of the way we had this discussion, because of the way our original legislation through town meeting is done. Whereas COAs, and you will find that, and in the scope, do a hell of a lot more than we are, and they can because of the way they were passed at their town meetings. We have talked about redoing our charter at town meeting to expand the scope of services, to expand our ability to do the other stuff that all the other COAs are doing. So that I'm gonna throw on your lap, because we've talked about this for a long, even before COVID.
So that is definitely something that we've looked, something that has crossed my mind, especially as I interact with more COAs elsewhere. I'm always willing to look at potential charter changes and structural changes. I think all of our systems and structures and councils and committees have been around for a long time, and often it's worth looking at how they're built and how we can change and make it work better. I know that in other areas, the way that, for example, we have our senior services as a separate element.
Right.
Whereas councils of aging run the
Services.
the senior services area, or a senior center specifically. So I'd have to look with admin and town council to see how if the bylaw wording is such that the senior services, the way that it's currently set up, there's a good reason for that, then we wouldn't do it. But I'd be more than happy to look into how we could alter the structure. If you have specific ideas for how you want it arranged. I unfortunately do not have time to do a proper survey of the structure, a proper survey of other council of aging elsewhere in other municipalities to see how they're structured. I'm not gonna have that time until after any special
Well,
town,
that's where Betsy might come in.
and that could
Plus
be,
you'll pick it up as you go along, and
well,
one
I,
of our big things is we don't have a budget. Which almost every one of them I
Oh,
saw
they
had a
sure do.
budget. So this is why we were created back in the '70s or early '80s. Without realizing how important these groups are going to be at that point. So now times have changed. Funding coming from the federal government is going to be slashed. I was talking to Roberto the other day at the Fairmont Center that I was working. And it's a disaster coming, absolute disaster coming.
What
But
is
we
a
have more,
disaster
we have
coming?
more.
federal.
It's all getting cut.
Absolutely, I'm not sure that we
So-
need to crank up what we're doing because we'll just be rained on,
So
No,
I'm-
but
the lack
we
of
can
money.
reorganize and have more
power.
power and more might.
So what do you, I think this is a topic that deserves like a proper agenda item down the road.
Yes.
I really do think that there are, like, we're looking at some structural changes in other boards that we're a part, that we're a part of.
Yeah,
We're looking at ways to manage quorum and participation more effectively. There's a lot of, I'm very sympathetic to this, to restructuring, but I'm curious, like, what, it would be more like, what, the two ways to approach this is see what other communities have set up, and then alternatively, what do we, that power is doing things. What things
Yeah.
do we want to do?
Yeah, I have to imagine that in the scope of Nantucket, the services offered for seniors were not the worst. We're certainly somewhere in the middle and maybe toward the higher end
I
in
would,
terms of what's offered here for people who are 60 years and older. But that's just a guess. And I think your community assessment will show where the problems lay in
And that's,
their minds.
like, that's absolutely one of the three major, like, the three major categories of stuff we're looking at. One of the, like, probably the second biggest one is the elder service coverage. We do have, like, we did there's a gap study that was done in behavioral health, and it doesn't cover the full range of health issues, and it doesn't cover transportation, et cetera, et cetera, et cetera. But it found that we were above or around the state average for services provided for seniors, which is unusual because for most things, because of our distance, we're below the average. Like in a lot of service provision categories, you know, a great one to look at is the number of clinicians to patients
Oh.
on Nantucket, specifically for behavioral health. The
that's-
statewide average was like 150 to like 180, upwards of 200 in bad areas to 1. Ours is 400 and something as a lowest.
Yeah.
But in terms of this train
you
wreck,
can't go to the next town.
Yep.
in terms of what's coming from the federal government and its effect on Medicaid, I worry about, we have a
NCH
hospital.
hospital.
Yeah,
And they know how to cut things in Boston, and I would not be surprised if they try to sell off this hospital. I'm just saying, if you really have to cut things because you lack money, we're an easy target, very.
so the one,
And the nursing
So-
homes.
and the nursing homes.
They're all
So
gonna
we're-
close.
so
To have major problems affecting
So the-
seniors.
Medicaid, Medicaid, compensation issues and the evaporation of a large portion of that budget is something that is really significant.
It
It is,
hasn't gotten through the house, it's back
No.
in the house at the moment.
It is a-
Does
it
not
is-
look good in the house.
it is a
It
safe,
doesn't look good at all.
it is a safe bet to say it will pass the House.
I don't think that's a safe bet according to this morning.
No, the Republicans are now rallying against it.
The
Yeah,
contingency.
they're not gonna have the vote. They only have 4 votes. They
The
only have to do is lose 5
The
votes.
contingency planning for us on a municipal level
Wow.
and on a state level is always, given the trends of the last 60 to 90 days, never mind the 6 months since Trump has taken office,
3.5
is that it
years.
will be worse than whatever is being proposed right now. Because even if the budget doesn't get through, the intent is to strip these funds from people. And however it goes, it might be that, much like they've done for the last 9 months, money that is allocated simply isn't dispersed.
Maybe pull it
Right.
back.
Which is illegal. It's already
It's
been
a laundry
allocated
list.
by Congress.
A
And you
long,
cannot stop it, so there'd be lawsuits to get it allocated.
and ultimately, those lawsuits must be enforced by agencies that report directly to Donald Trump.
Well,
It's
we don't
not
have-
something that's gonna be resolvable by a bylaw amendment to the Council of Aging.
No,
But I do think that we should really, we absolutely should look at different structures and different patterns that we have things set up to be in. And that is something that I think deserves probably more than one meeting. I think it's gonna be a meeting for us to figure out what we want out of any change to Council of Aging. And then it'll be a meeting for us to discuss what is within the current structure, because I bet there's things we can do that we haven't done under the current order, just because it hasn't occurred to us to try yet. And then we look into what it takes to do a bylaw amendment, get it through the legal review, and then do the messaging that has to go before you get anything past the town meeting.
can you
Well, I'd
imagine
like to
the distress
suggest-
on CRC?
I'd like to suggest that we wait until after you have the results of your community assessment.
So
So
Just something to
really
throw on the table while you're doing your fact finding, start looking at some of the mechanics.
the community assessment will not be completed for a year. So anything that, if we table it until after the community
Well, I
needs.
don't think we're in a rush to reorganize.
Okay.
No.
Then
It's just something we gotta talk about.
Because the other two adjustments the other two potential asks from town meeting that I have coming up would be things that we would be trying to either get in a special or annual. If there is a
You're
special,
telling me there's no special, but
there may, it's
Who knows?
unknown. But either way, it'd be stuff it's better to get ahead of rather than be trying to do it at the last second. But yeah, I think we can absolutely check into that, and that's something that we should do.
yeah,
And that actually could be a good segue to talking to the head of the Massachusetts Council on Aging too. That could be a good introductory topic to have a discussion on.
Well, what I would do is send Betsy an email introducing you to her and say that you are working on this big planning study.
Oh.
And it includes councils on aging, and could she perhaps spend some time over the next few months talking with you?
Yeah, I
we
think that
don't
should be
have to
fun.
reinvent the wheel.
Oh.
People have already gone through that.
Oh, yeah, no, but it's still, when you make any change in the structure that you're using to do governance, you have to you don't want to be changing the structure of government on a whim. You want to be doing it with look at
Yeah.
other jurisdictions and then see what it is that we're trying to do. Because honestly, I only want to change stuff if stuff needs to be changed. If we can accomplish what we want to do without having to do a charter change, I'd be happy, I'm happier with that.
Well, it's just it's a bylaw change. I don't have to change the charter because it's not actually in the charter. So I just read the whole charter again the other day. But it's just go back to town meeting and do a new warrant article to establish COA this way.
Yeah.
Because it was like this long when they.
Oh, yeah,
did
I think it
first
was just,
time.
we're gonna do-
Not the language.
Yeah, there was some language around how the governance structures would be built, but it was not a lot, and it's not the same as in other town charters I've seen, or other bylaw lists.
Okay,
Are there any comments or questions from those of you on Zoom? I don't want you to be left out of this discussion.
look quiet.
But
No, we're
governance
good. I'm good. Just listening.
Okay,
governance isn't the most interesting topic of your day. Comparative analysis of town bylaws by
I'm the town bylaw wonk.
The other thing is, this is when I traditionally solicit questions from anybody about anything that has to do with the town. Sometimes it's hard to know who to ask about things. And I will at least try to get answers for you. If I do not know, I will try and ask around to figure it out. So if anybody has any questions about anything going on in the town, feel free to just either ask now or shoot me an email. And I will try and demystify whatever it is that we're doing.
So what's next?
thanks, Erica.
No problem. Laura?
Next on the agenda is Laura, who sent us her monthly report in advance. So I know you always ask Laura if anybody has any questions or comments about it, so I'm doing that for you, okay? You're ahead of things. You're on top of it. Any questions, comments for Laura? No. And I also want to thank you for all your help with the Seniors of the Year and setting up this thing with the VIPs. I appreciate all the help.
My pleasure.
As you know, I need all the help I can get, so thank you. Next up is Robert Kucharabi to talk about elder services of Cape Cod and the Islands.
It's bleak. It is
Bleak.
bleak. We're in a holding pattern, just waiting to see what comes. That's all you can do.
Yeah,
And I think it's gonna be like that until at,
Yeah.
3.5 years.
well, we'll be able to start making predictions about what it's gonna look like after the budget passes and once the, like, the first round of expenses go in. Right now, we're just looking at the budget proposals and having to like assume the worst because that's been a safe assumption for a bit.
I do know that the Community Foundation is in the process of giving another grant to elder services.
And I know that there's been a couple of other approaches to funding a lot of the same services. And I know there's a couple of grant writing or grant payout organizations that are reprioritizing their funding to be stopgap funding for things that are lost. So I think the nonprofit and the philanthropy, as well as sort of state level funders, are trying to react as best they can.
The meal,
Yeah, they're gonna cut the Meals on Wheels. That was in the cuts.
right, but see, we get the grants from the Community Foundation specifically for Meals on Wheels.
Oh, God. I know because she has spoken to CRC and stuff before about, funding that's been lost over time from the state feds.
Yeah.
And
Even before
it's
this,
been going down and down and down, but we made her ask for more money for something.
so we also fund the contract, like the contract review committee also funds some of the travel and preparation costs for the Meals on Wheels program and congregate lunch, so.
The tent cards were a big success, even for a short term, and they're gonna be continued in the future.
Oh, good.
It did
And you
work
can
out quite
expand the
well.
number of restaurants?
Huh?
You'll expand it. to-
Yeah, hopefully expand the
new
number of restaurants, especially on the Cape. But it was a success that we're gonna try it again.
Oh, good. Great.
And it was easy.
Any questions for Robert about elder services of Cape Cod and the Islands?
Great report.
Thank you. Your next report is
On the road.
much better. Optimistic.
We've finished up the monthly programs. And during July and August, we have offered private tours to the seniors to come and see the nature exhibit at the NHA. Salt Marsh has booked 2 tours, and so has Our Island Home. And yesterday, Sherburne Commons did a walkthrough with Michael Harris and Nina Hellman, organized a whole trip of about 8 people to come through.
What's the major,
Behind the seams, like in sewing seams.
oh,
It's all about textiles and clothing on Nantucket.
cool.
Pieces that have never been seen are coming out of the archive and are on display.
Great.
Yeah, that's good.
I'll tell you, you can do a big thing on that as Elizabeth.
Elizabeth's a very important part of it.
Very important part of it.
She's
because
featured in it.
She taught me how to do that uniform.
Yeah. And for overseas, we wound up April. And in September and October, we kick off back to the Cape with 10 visits over 6 days.
Wow.
And we're looking at expansion into farther into the state.
Great.
It won't be till spring 26 at the earliest that we'll start expanding upward.
Yeah, wonderful.
I can't even believe we're talking about July
This year has
of this year.
lit.
Crazy.
Questions or comments for Robert about the Whaling Museum, NHA, and
We
the
follow the Nantucket Historical Association.
Nantucket Historical
NHA.
Association.
NHA is good.
And it's outreach to seniors.
It's always be the Whaling Museum for some of.
Well,
us grew up
it's the Whaling Museum at the Nantucket Historical Association.
That's great. To those of us who grew up here and rampage through the old Whaling Museum on a rainy day.
Any comments or questions for Robert? Okay, last thing on the agenda is the Council on Aging had 2 grants for the year 2025. They've just ended. We paid $8,000 toward the improvements, the recent improvements to the salt marsh. If you haven't seen
Oh, yeah, the door is called.
the door that used to have that big
I
sign.
noticed something
that said,
different when I
"Not
pulled in there.
gone." It's a beautiful window, so when you walk in, you see the light coming in there, they did a beautiful job on it, so. We can pat ourselves on the back, we paid $8,000 toward that. That was probably almost half of the cost of the construction, but it looks great, and they're repairing also the ramp at the top to make it easier for wheelchairs to turn at the top. And so that's us, give ourselves a pat on the back.
That was FY 26.
Pardon?
That was FY 26.
But they called it 2025, the
We
state.
just ended 26.
No, we just ended 25.
No, we didn't.
Yeah,
We're in FY
26.
26.
we just started FY 26.
Okay,
So
so
that.
Yeah,
that
this
grant-
ended
th-
June
those were-
30th.
Those were FY 25
Okay.
grants.
And the other one.
System.
The other grant was for the memory cafes, that have not had huge participation, but they've had some regulars coming back, so 6 regular people. And, I think that was a success. We got $7,500 toward that for staffing and programs, and they had musicians and, art teachers and that sort of thing. And I'd say it's a success. They're gonna keep it going, not with money from us, but we have to, by July 30th, we have to submit our final reports on both grants. I will make sure everyone on the Council on Aging gets a copy of the reports, and you'll see the photos that go along with them. And the photos of the memory cafes are so touching to see these people who have cognitive impairment really engaged in planting flowers and doing their art projects. And the photos are just great. Yeah, I was gonna suggest them for the newsletter, except I don't know if people want if with cognitive impairment really want to
we
be
have to ask
seen.
them.
Yeah.
I don't suppose they shot from the backs of their heads.
No, they were
That's
just
the problem.
shooting what was going.
You just ask the families.
Yeah, well, you'll see them and you'll see if there's something that you might be able
Yeah.
to use.
We had put some money from a state and regional grant into backstopping that for a chunk of time, and they were asking for pictures, but we need to get full releases on everything, which can be complicated.
Well, you look and see if you can pursue that.
Well, but yeah, definitely send them either way.
Yeah, and I'll send them to everybody on the council, so you see what our money was paying for and that it was successful.
Well, I'd like the Current or the paper to do something on this, and maybe we'll get more involvement because they can see people are really integrated and doing stuff, and this is really a good thing for people that are at home trying to figure out how to deal with cognitive
Yeah.
impairment of a spouse or something.
And Karen, I mean, one of the things we asked them to do in I think it was last year funding was to do more outreach and marketing to
That was a big
caregivers.
deal, yes.
Well, so they've definitely stepped up their like for the last 2 years, they've done a really good job of advertising directly to people who would go to it. The difficulty is that it's hard to get people to go to something that's associated with cognitive impairment if there's a lot of concern about actually being cognitively impaired. That's a definite concern to people. Advertising to like the kids and caregivers of seniors is another approach to doing this. And we've been looking at ways to do that a little more effectively. I know there's a ton of referrals out. It's always in the resource packages for elder services when they contact people. It should be in basically all the senior service providers resource list of opportunities and actions. It's just really hard to get that last chunk of the community to go.
Mm.
That's what I'm saying,
go,
there's something
you know?
positive in the Current. Or they do a story on it and people sign off, they have to sign a release. I mean, you can't get any bigger bang for the buck and we don't have to pay for it.
Yeah, ideally. Ironically, the only thing that the Current wants to cover right now is the wastewater sampling for drugs. They love that story.
Did I miss that one?
We expanded the wastewater testing for COVID into doing flu,
Oh,
RSV,
drugs.
and then
Drugs, that's great, it got lots of coverage.
it got a lot of
What
coverage.
did
But
they find?
So it's not whether they find, we're monitoring levels and concentrations in the wastewater over the course of a year. And then we'll see if we learn anything from those patterns, and we'll have a solid material check on what drugs are used, whether they're the medical versions of them. We'll be able to track a whole bunch of stuff. We'll be able to do early warnings if there's signs of a spike in consumption. And mostly just we'll get baseline data on the level of drug use, what kinds of drugs, and what human services and substance misuse interventions we need to do. As a campaign against misprescribed medicinal painkillers is going to be very different than one against abusive or Xanax or, like it's a very different approach, and we have a lot of opinions and a lot of surveys, but we have no actual physical material data, which is, but like for the real benefit from that is the flu, the COVID, and the RSV tracking, like none of which is interesting to the Boston Herald.
One other thing I just want to mention about our grants, because it was the fact that we collaborated with the community school and they did all the work. And they did a great job. Brian Lenane, who's their program director, was terrific.
Which
and
conference room was that for?
Memory Cafe.
Memory Cafe, and Jennifer Costanza, actually ran the programs. And they had people like Steve Shepherd came and, he was a musician at one of these things. So it's great to get community people entertaining these people and getting them involved. So that, I just think it was a great program. It's too bad it only has a few people, but sometimes it takes time for these things to catch on.
But I think if
It's
of
That's good.
rebranding, making people realize that you don't have to have, it's not like you don't need a diagnosis to go to this. It's just, what I've read, this is some of the stuff that I've read about from other councils of aging and from other places doing other services, is that a lot of these programs don't feel like they're a senior focused program, or they feel like they're a sort of organic event that people do, not like, he's got a bad memory, he goes to the memory cafe kind of thing. That is really hard. Once you get them up and going, and once people are sort of confident in it and have that interaction working, we just don't seem to have hit the critical mass for that as yet.
Cool. Good stuff.
That's the last item on the agenda. If anybody else has any items or questions, now's the time.
I'll make a motion to adjourn if nobody has any.
I will second it.
And it's,
Okay, I have to ask everybody if you want.
3:46.
So this is your voting to adjourn. Robert,
Yes.
Erin,
Yes.
Lisa,
Yes.
Linda.
Yes.
Mary Ann, yes. Thank you, everybody. Have a great.
Looks like the traffic is fake.
I
breaking up.
can watch the traffic just slowly moving out.
Well, it's moving better on
Moving over there.
roundabout.
Nope.
Oh, no.
People on Zoom.
I was just looking out the window.
Thank you,
there.
everyone.
Thank you, guys. I'm trying to do I wonder how many